Yes.
Hello,
Yes,
yes, sir.
so we have got the password and we are already live, sir. Thank you so much, sir. So,
Okay.
should we get started?
Uh, yes,
Okay.
sure.
Okay. So, good afternoon and a warm welcome to all the dignitaries present here. Myself, Rupsha from ClearNet, assigned as a session assistant to ensure a seamless experience. ClearNet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for doctors. It is with great pride that ClearNet is the digital partner of this event organized by National Neonatology Forum, Gujarat. And the topic of today's session is POCUS Series 19 Anatomy of Cranium, what minimum neonatologist should know. So, without any further delay, I would like to hand over the session, Dr. Kunal sir. Over to you, sir. Please proceed with your talk.
Yeah. Thank you so much, Rupsa. We are starting with our Neonatal Pathshala series for 2025. So we are lucky to have Dr. Kiran More sir. He is an expert in this and has taken wonderful lectures before also. I thank you so much, sir, for joining us. I hope that we will be continuing with our Neonatal Pathshala series under the leadership of Dr. Nirmal Choraria, sir. Unfortunately, he is not able to join for this session, but he will definitely join from next. We continue our Neonatal Pathshala series on every Wednesday between 3 to 4, and I request all to join. As well as we go live on the YouTube channel, and this thing is posted on the YouTube channels also. So I request all to join also. For the further proceedings, I request Dr. Vishal Goel, who is our project in charge for this year for 2025 for this Neonatal Pathshala series. Over to you, Vishal.
Thank you so much. And I think last year I would like to I would like to introduce the Dr. Kunal. He is doing a tremendous work since last year, I think, and under her vision and also Svetal Madam vision, we won the base branch. Of the Miss Base branch of the NNF last year. So thank you so much for that one. So before I start, I would like to introduce Dr. Kiran More sir, and he's one of the renowned faculty. If I talk about neonatology, if I talk about the hemodynamics, he's one of the few people in India there who are doing a really great. If I talk about the his achievement and everything, I think it will take another 15 to 20 minutes. But would like to give some brief introduction. He's a senior neonatal consultant and head of the department and lead for clinical research for MRR Children Hospital, Thane, Mumbai. He did the multiple fellowship overseas. I just read the CV of his, and I think he had a great experience from the Australia, Canada, France, and everywhere. And I think he has a multiple publication, more than 45. And he's also one of the author of the four chapter author of the four books and the three grants, and he's one of the formal president for NNF Katha branch and associate editor for the NNF Journal India and Vadia Journal of Women's and Children Hospital. And his special interest is in the neonatal hemodynamics, echo, POCUS, ECMO, neonatal ventilation, stimulation, probiotics, and developmental follow-up. So I welcome Dr. Kiran More sir, and I remember when I was in UK before I that have a talk with Ashish sir, and he told me that he must, have a talk with the Kiran sir. Because of him, I think one of the reason that I had an experience overseas, and he guided me a lot. So I thank you so much for that, sir. And over to you, sir.
Thank you, Vishal, for generous introduction. And I'm glad this is so. Let's get on to the topic. So today's is the beginning of series of cranial ultrasound, and today's topic is very basic. And but without understanding the anatomy, we cannot progress to understand the views and other things. So I'll probably take not more than 30 minutes to cover this topic, and hope it will help you to learn. Mm, so see, cranial ultrasound is very important in newborn practice because it's a kind of a procedure of choice for investigating the brain. We don't tend to do CT and MRI as often as the older population and the adult physicians will do. And nowadays, with good machines, we have very high resolutions and cranial scans, which are as good as MRI. And in our expert hands, we basically can get all the information what we need, and it's portable. no ionizing radiation, and relatively affordable. And the newborn brain has this additional windows which give us to look into the brain. So there are lots of advantage of cranial ultrasound. And now we as a neonatologist, we would like to learn ourselves, because we are not dependent on the radiologist all the time. In the middle of the night, we want to look at quickly there is a bleed or edema or all those things, sudden deterioration. We can ourselves scan, and that is very helpful in clinical management. I think a lot. I will skip this when to screen and all those things. I think will be covered in the next thing. But there are different guidelines to follow. How many, like, 2 scans in first week and then another one in 28 days. And if there is an abnormality, then probably you do a weekly scan and once in 2 weeks, something like that. Some guidance is always there, which we will try to cover in the next class. And there are various indications for which ultrasounds can be done, either for HIE or bleeding or brain sudden strokes, vascular abnormality, some malformations, and then monitoring of the hydrocephalus, etc. So let's get on to the basics anatomy. We all need to know, and I will have 3 parts covering, mainly the external anatomy of different lobes. Then we'll go into the deep dive into the ventricular system and the basal ganglia, etc., and how they are spatial relation with each other. And then briefly about vascular anatomy, which cover the other topic. So I'll I'll just take you to just take share out and try to share the. So yeah, so basically this is just to cover up and know that which what are the parts of the brain. And again, all of us are very good in anatomy, so we don't need to redo this, but just for completion, we will cover up the external anatomy. As we know, this is the front part of the brain, which is the frontal brain, and it is separated from the posterior part, which is the parieto occipital part, which is showing a little bit brownish color, and the thing which separates the two is called as central sulcus. So there's a sulcus or a gap which is separating the two, and this marks a very important landmark, because on either side of the central sulcus there is a precentral gyrus in this portion in the front, which is a motor cortex, and then there is a postcentral gyrus, which is the sensory cortex. So I think any abnormalities in these portions can have a devastating effect. So that's why knowing this external anatomy is very important. And then the posterior part is the occipital lobe, and which we know that it's a very important structure in the brain, which has got a visual center, and especially in hypoglycemias and all, you can have occipital lobe injury, which can cause the vision. And then the pink post lobe, which is the temporal lobe, it folds anteriorly underneath and inferior to the parietal and frontal lobes, and it is separated by the another sulcus, which is called as lateral sulcus or the Sylvian sulcus. Okay, so even if you know this much landmarks in the brain, I think that's good enough. And same same thing will be seen on the other side. So frontal lobe, parieto occipital lobe, central sulcus, and either side will be precentral gyrus, postcentral gyrus, occipital lobe, and temporal lobe, and then Sylvian fissure. So I think till here it's very easy for everyone to understand. Now, anteriorly, this gap is there, which will go in little detail. What is this interhemispheric fissure and all those things. So here in anterior view, this gap, which is separating the two frontal lobes, this is a fissure which actually it dominates the your orientation during the imaging of the coronary planes, because it's a kind of a space between the two lobes, and this place is filled up with a something the cerebral the dura mater, which is the falx cerebri, which goes inside this, and it's a dural fold that descend into the fissure, and then it carries the anterior and posterior cerebral arteries, and it also contains the two important sinuses, which are called as sagittal sinuses. So there is a superior sagittal sinus, which is marked in that triangle, and then there is an inferior sagittal sinus. So it goes like a 3D structure in the brain, and on top and the bottom of it, there will be two sinuses, which is superior sagittal, inferior sagittal sinus. And when we do the scans, looking at the flows in the sinuses or any clots or thrombosis in the sinus is very important, because babies with severe dehydration or polycythemia, or sometime with coagulopathies or hypercoagulable states, can have a thrombosis in these vessels. So that's all we need to know. Interhemispheric fissure, and then sagittal, superior sagittal, and inferior sagittal sinus. And posterior part of the brain, again, only structure there here is obviously occipital lobes are more visualized and prominent in that region. And the plane between, then the structure which starts appearing is the cerebellum. So as you can see, it's a separate structure inferior to the cortex, and you can see the plane separating the cerebellum and the cerebral cortex. And then there is another dural matter which covers that area, which is called as tentorium cerebelli. Okay, so this tentorium carries two transverse venous sinuses. So we know superior sagittal, inferior sagittal, and then the transverse sinus goes through this tentorium cerebelli. Okay, so again, just to remember these names. And cerebellum has got two hemispheres. Lateral hemisphere, which is separated by the central portion, which is called as the cerebellar vermis. So that's it. Occipital lobe, tentorium cerebelli, hemispheres, and vermis. And that covers the external anatomy. So far, I think it's easy here. Now we are going into the next section, which is the internal anatomy. Now for internal anatomy, we'll go from in to out. So we'll dissolve the brain and we'll get into the third ventricle. Yeah. So now, so here I generally like to do interactive, but I think we have very few people attending live. So I'll just go myself and covering. So basically, this is third and fourth ventricle. So third ventricle and fourth ventricle. This is the view from the side. And the two lateral ventricles basically are not in this picture. We'll add them later. But the two lateral ventricles will feed into the third ventricle with something called as this interventricular foramen or foramen of Monro, which will come in the next when we add the lateral ventricle, but that's where it begins. So lateral ventricle will go into the third ventricle, and that connects through the interventricular foramen or foramen of Monro. And this is the whole third ventricle that drains posteriorly into the cerebral aqueductus. So cerebral aqueductus basically connects the third ventricle with the fourth ventricle, which is this. Okay, so third ventricle, aqueductus, and fourth ventricle. So only thing to remember in this is that the foramen of Monro, or better way to remember is interventricular foramen, is the foramen which connects the lateral ventricle into the third ventricle, and then the aqueductus sylvius connects third and fourth ventricle. That's all you need to know. So you can see this how they are placed on either side. So this is sagittal, and then this is coronal view. Now, if you add lateral ventricles, see how it is seen. So best way is to see the lateral part. The sagittal view is very easy to understand, which actually gives all the ventricles in one plane. So, so if you see the lateral ventricle, now this is the inner view, inside view. So it's so basically your lateral. This is the right lateral ventricle. Lateral ventricle is a crescent-shaped structure, and that is provided in the center or the core of the cortex, cerebral cortex. And it has got different parts, such as this is the anterior horn or the frontal horn. which extends into the frontal lobe, and then it has got the central part, and then it has got the posterior horn. So three parts are there: anterior, central, and posterior horn. And then we heard the interventricular foramen, which is now more evident here. So the interventricular foramen or the foramen of Monro that drains medially into the third ventricle. So you can see the how nice connection from lateral ventricle to the third ventricle through the foramen of Monro. Now the lateral wall of the central portion of the lateral ventricle has got two parts adjacent, which is called as the caudate nucleus. So basically, you will see the caudate and then the thalamus posteriorly. And I think once we add the cortex, you will be able to see. We will add the basal ganglia, then you will see how it is seen. But basically, they lie in that inner curve of the lateral ventricle. So caudate in the front and thalamus behind. And posterior horns, yeah, we already talked about. And then the inferior horns. So anterior, central, posterior horns, and the inferior horns. Now the inferior horns, they learn in the temporal lobe. So it's like a claw, the claw-shaped structure. The thumb is formed by uh, the um, the inferior horn, which is in the temporal lobe, and this is the central part, and then the frontal part, which is the anterior part. So these are the parts of the lateral ventricle. So and there are two ventricles, right? So right lateral ventricle and left lateral ventricle, and they both will connect from sides through the foramen Monro into third ventricle, which is the central structure, and then aqueduct of Sylvius to the fourth structure, to the fourth ventricle. So see here, this is how it is seen in the. This is the inner view. This is the outer view, and this is how beautifully you can see the ventricles are connected. So lateral, third, and fourth. Now, if you add cerebellum, then you can see that cerebellum is covering it sits at the base of the brain and basically in the posterior fossa of the skull. And the fourth ventricle is actually more anterior to the cerebellum and not running through it as it is shown. It is little up, so slightly the cerebellum should have been little bit below. And we already learned that there are two cerebellar hemispheres connected with cerebellar vermis. So thus we need to know the spatial relationship of the cerebellum just beneath the fourth ventricle. Now, if you add basal ganglia and then rotate the model, so this is external model and this is the internal model. So as you can see here, you will see much more clearer how the claw and the inner portion of the claw basically accommodates or sort of holds the basal ganglia. And basically I think here it's much more evident. So the superior medial surface, the front and the medial surface and the superior surface is basically formed by the caudate nucleus. And that's where also the germinal matrix lies, the caudothalamic groove. That's where the germinal matrix also lies. And the posterior surface is formed by the thalamus. So caudate at the front, thalamus at behind, and in the junction is the caudothalamic groove where the germinal matrix is there. And I'll talk in a slide what germinal matrix is, but it's a kind of primitive developing vascular structure which generally involutes by 36 to 38 weeks. And it's very prominent about 2 to 3 millimeters in 24, 26 weeks. Then slowly it regresses as the baby becomes more mature. But because it's very bulky in the first week, in the premature babies, they tend to bleed through that. So this is how the structures are connected. So see, if you can see in the coronal plane, lateral ventricle, third, fourth ventricle, and basal ganglia. And then the other remaining blue structure is the brainstem. So basal ganglia and brainstem in the middle. And then this gap which is seen, which is actually separating the two ventricle and in the septum is your septum pellucidum. And below that thing, the septum, in premature baby, there is often a fluid filled space which is called as cavum septum pellucidum. I'll show it in the ultrasound landmark, not very much evident in this view because they are more separated out. Generally, they are very much closer. Only a small gap is there, which is fluid filled called as cavum septum pellucidum. Now we add the cerebral ventricles, ventricles, and that's how it is seen. And if you see this green structure now has appeared, that's your corpus callosum. So just above where the cerebral hemispheres are, the greenish structure is the the corpus callosum, which is a connection between the two cerebral hemisphere, and it's as we know, it is for coordination and coordination between the two brains. And we can always measure the size, etc., on the ultrasound to see if there is a corpus callosal agenesis or hypogenesis or all those things. And then you add the left cerebral hemisphere, and that completes the brain. So I hope the external anatomy and the internal anatomy is clear so far. Any questions on this? Okay, I'm assuming no questions. So we'll just quickly do the vascular anatomy, and then I'll show the same things in the in different views. So this is the vascular structure. Again, you don't need to know a lot in details. So just to cover a few things, lateral view is again much better to learn. So we know that carotid arteries will enter, internal carotid arteries will enter the brain and through the carotid canal, and then just after entering, the intercarotid artery divides into anterior cerebral artery, which runs medially and then superiorly between the hemispheres, and there is second is the medial cerebral artery, which is runs lateral to the surface. So the artery which goes anteriorly and superiorly and medially is anterior cerebral, which is this, and the other artery is middle cerebral artery, which runs lateral to the surface. So to locate the middle cerebral artery, you have to go more lateral windows. So you have to scan a little bit in the next to the tragus or in the lateral temporal windows, only you can get the middle cerebral artery. Vertebral artery, generally you don't want to scan, but you need to be aware if you're doing an MRI angio. It enters the foramen magnum and join to form the basilar artery. That's the basilar artery. So vertebral arteries and the basilar arteries. Again, not much clinical significance. Our interest is mainly ACA and MCA, and sometimes carotid and your vertebral arteries. All right. So that covers the anatomy. Now we'll just see the anatomical landmark on the this thing on the ultrasound, different sections. So generally, to visualize the brain, you have to have two different sections. One is coronal and another is sagittal. Okay, and then there is something called as posterior windows. So which is there from the posterior fontanelle. We'll not go into detail about the landmarks in the posterior. We'll focus on the coronal and sagittal window. What are the anatomical landmark? The whole views, how to acquire them, what are the specific things to look after, all these things will be covered in next class. What are the different C1, C5, C6 sections, all that will be covered in the next class. I'm just going to cover the landmarks as we learned. Okay. So if you look at the coronal view, basically it is cutting the brain anterior to posteriorly. You're making multiple slices of the brain by sweeping your probe from anterior to posterior. So what probes we use and all those things, details to be followed in the next class. Here I'm just trying to cover the anatomy. Now, as you can see, when you cut, there are generally 6 sections, but for the anatomical landmark, I'll try to cover the 4 sections at different level. So the one can start with the anteriormost section, which is um, the frontal lobe, a frontal view, where, as you can see, the brain is cutting it in the anterior portion. So you are angulating little anteriorly and you're cutting the frontal lobe. So if you open up the brain, what you're going to see is this. Okay. So here now, so what are the structures to identify? So we just learned different structures and their special anatomy. So again, just going through special anatomy. So these are the lateral ventricle. We know the lateral ventricle will connect to the third ventricle with foramen of Monro, and the middle structure is your cavum septum pellucidum. So see, it's a fluid-filled structure that you will appreciate more in the actual ultrasound view than the anatomy. So that's the side of the cavum septum pellucidum. So septum pellucidum is there in the middle, and then it forms a fluid-filled space in the just at the bottom between the two lateral ventricles, and that's your cavum septum pellucidum. Now here, generally in the frontal lobe, you are cutting the basal ganglia in the anteriormost portion. So you have only a caudate nucleus can be seen, which is adjacent to the lateral ventricles. We saw how that blue structure was adjacent. So if you cut the section anteriorly, you will only get the caudate nucleus and no thalamus. And sometime there could be a part of putamen might be seen. So caudate and putamen little below and thalamus is behind. So structures again, interhemispheric suture, lateral ventricles, cavum septum pellucidum, and a bit of a septum pellucidum and cavum septum pellucidum. And the other thing is the bright structures in the anterior part, which are which is the sylvian fissure. So sylvian fissure is the fissure separating the lobes, hemispheres, which we saw. And so then below that sylvian fissure is the temporal lobe, and the above that is the frontal lobe. So frontal lobe, sylvian fissure, temporal lobe. That's all landmark we need to identify. Then if you go to the mid-ventricular view, so you have to sweep back a little bit at the level of middle of the ventricles. So if you open up the brain, now you are at the middle. So you will be cutting your lateral ventricles. So these are the lateral ventricles again. And also you will start seeing the third ventricle. You may not see the fourth ventricle unless it's dilated. Very difficult to see all three ventricles in one line unless they are dilated. And now you will see the just little bit small anterior part of the choroid plexus in this view. So choroid plexus will show you in the sagittal view how they are extending. So in the mid-ventricular view, you can identify just the tips of the choroid plexus. Rest all is still same, interhemispheric fissure, lateral ventricle, and then what starts appearing is your the basal ganglia. Now we are cutting it a little bit behind. So now you will start seeing the thalamus. You are at the level just beyond the caudothalamic groove. So basically, thalamus dominates the posterior region, and then there's a putamen laterally. So thalamus in this region, putamen in this region, and sylvian fissure again will be seen. And yeah, you have the temporal is separated from the parietal here. So in the frontal view, there was frontal lobe. Now this is a parietal lobe. So a parietal lobe, sylvian fissure will be still there, which is here, and then you have a temporal lobe. So identification marks here to differentiate are mainly ventricles are same, but you're seeing more of thalamus and putamen. You may see third ventricle, which is not very apparent in this view, which is as apparent here. And then the yeah, sylvian fissure is separating temporal and parietal lobe. So suppose there is a bleed or anything here, you will say it's a parietal bleed because you are at the level of mid ventricle. So you're cutting the middle portion of the ventricles. Then the foramen of Monro view is slightly little anterior. And that's why basically you are trying to show the connection between the um, lateral ventricle and third ventricle. So as we know, these are the lateral ventricle. We know this is the third ventricle, and then connection in the middle is called as foramen of Monro. So again, once you start scanning, probably you will identify where exactly the view, which view is exactly what you're looking at, where exactly the foramen Monro is. That more to be followed in the practical classes. I think when Dr. Mohit also will demonstrate, and somebody will cover next time. Now here, other structure as foramen of Monro level, which is appearing is the new structure which is seen is tram-like signs. So this horizontal tram lines or the like the like the rails or the tracks of the tram. There are the two horizontal lines will be seen, which marks the corpus callosum, which runs across the base of the hemisphere, and uh, so that again you can do thinning of the corpus callosum here. You can measure the width, etc., and can comment if it's absent or dysplastic. So in this view, you can talk about it. And other same structures will be there. You have this interhemispheric feature and Sylvian fissure, which will be separating from the um, temporal lobe from the precentral cortex. So you are at a precentral cortex level here when you are at the foramen of Monro. So again, my focus is structural anatomical landmark identification and not going detail in the views. And the posterior view, when you posteriorly sweep further down, and if you open up the brain, what has happened now? You are gone into the posterior horns. So posterior horns of the lateral ventricles are open now. So what you are seeing is a very different structure because you are just sort of scanning across the posterior horns, and that is filled up with a choroid plexus. So not seen in the model here, but as you can see, these whitish echogenic shadow, which are bulky, they are basically the choroid's plexus. And often this can be confusing because blood also looks like this only. But if they are symmetrical, and once you visualize yourself that, okay, this looks like choroid plexus only, it's not extending further, or it's not looking too big, or it's not extending into parenchyma, and then you can be assured that this is choroid plexus only. Cerebellum can be imaged in the posterior fossa. Okay, once you get expert, you can get into posterior fossa, and yeah, the parietal lobe is also there. So I think this is kind of just to identify the landmarks in the coronal view. We'll just go and cover up the sagittal views. Yeah. So sagittal views are basically sweeping from side to side, as you can see, and you have to do this kind of a movements uh, of the probe. So coronal was anterior posteriorly. Here it is side to side. So three views grossly you can look at in this view. Again, anatomical identification. So once you open up the brain, the same thing which we saw, we can identify in this view. Okay. So basically, here the different parts which are this is a midline view. So you get a lady in the gown appearance. This thing which you are able to see, the ventricles going on to the cerebellum. This is the lady in the ground view. Those who know, again, I think somebody will cover this, but basically this is kind of a head, and then this is a lady, and this is the gown. This is kind of a lady in the gown view. But basically for structural identification, the thing in the midline view, you will be able to see the corpus callosum very nicely. This is the view you can comment more on the corpus callosal agenesis, width of the corpus callosum, all those things. And yeah, I mean, there is a genu body and the posterior regions of the different parts of the corpus callosum also you can identify. And the cavum septum pellucidum will be seen also in this view from the lateral view, as we learn that it's a just below the septum pellucidum there's a fluid filled cavity called as cavum septum pellucidum. And I mean this is more prominent in the premature babies, it gets less prominent in the term babies. And then yeah, the foramen of Monroe, if this again very difficult to specifically locate that space, but yeah, once you keep doing it, then you know, okay, this is a connection between fourth lateral and for the third ventricle, foramen of Monroe, and then the third ventricle, which is this structure, and then fourth may be seen, very difficult to show in the ultrasound, but theoretically it lies just anterior to the cerebellum, and cerebellum is little behind. So between brainstem and the cerebellum, you have the fourth ventricle. Okay. And the ventricular view, just again to see, if you want to just focus on the ventricles, the lateral ventricles, where like a clock-shaped structure, you can identify nicely the inferior horns, the anterior horns, and the frontal horns or the anterior horns and the posterior horns. And the important thing to mark here, the choroid plexus. So in the posterior horns, more towards the anterior wall, you have this bulky echogenic structure, which is your choroid plexus, and that's the site of your secretion of the fluids or the CSF. So this claw, anterior frontal horns, central horns, inferior horns, and posterior horns. So in the posterior horns, the anterior portion, you have the whole choroid sitting there and extending. As you can see, it's extending up to almost middle portion. And that is what the tips of those choroid plexus, which you are able to see in that mid section. So you have to see if there's a smooth extension of the choroid plexus from the posterior horn to the anterior horns. And then now in this view, you will start identifying, see how the thalamus is located and the caudate nucleus is rotated. So caudate nucleus is more of an oval structure, little bit more anteriorly. Thalamus is a rounded structure, a little bit posteriorly, and in between these two is the caudothalamic notch. So caudothalamic notch has germinal matrix, which causes bleed, and that's your grade 1 germinal matrix hemorrhage. Okay, so again, anatomical landmarks is very important, and that's the posterior fossa. And then if you just go little lateral, sagittally, a little more lateral, and you open up the brain, you will get just a slice of the lateral part of the brain where you are out of this ventricular view. So now midline, if you cut, you get ventricles. Little side, you'll get more of lateral ventricles and the caudate thalamus or the basal ganglia. More lateral you go, you are into the cortex of the brain. And then this has got all parts we know, frontal, parietal, occipital lobe. So any injury you mention accordingly, it's frontal ischemia or whatever, bleed, etc. And then Sylvian fissure is more prominent, as you can see in this, more prominent silver fissure will be there, and frontal, parietal, occipital areas you mark. And if there is a PV echogenicity or cystic changes, all this can be seen in this view. And then as the maturity goes, the sulcation and everything matures. So this view, cortex view, actually tells you a lot of changes and also helps you to determine the gestation. So as you can see, the 24-week will be very smooth brain, no sulci gyra. The 32-week will be 32 weeks will be like this. A little bit of more sulcation gyration has come up, and the term baby will be more evolved, more sulci gyri. Okay, at 40 weeks. So same baby, you can see from smooth to little bit more complex brain and then very complex brain at 40 weeks. So sulcal pattern and maturity can be comment on this. So with that, I come to an end of the anatomical class. I have just maybe 2-3 minutes, 2-3 minutes more. Uh,
Thank you so much, sir. It is really, really informative session. And as you know, if your base is not clear, then definitely it is difficult to find the pathology. So I think it is one of the base, to see the further session for the head ultrasound. Sorry, sir. Do you want to just
no, no, I was just
say
showing some
anything further?
anatomical landmark. Yeah, yeah.
Okay, okay. Sorry, sorry.
Just no, no,
Just
just how exactly in the brain coronal plexus are lined up. If you see this actual cut section of the brain, that's how the coronal plexus are lying. The where the CSF is found in the posterior horns, and this is how the germinal matrix is seen in a H&E section. So if you take a slice of the brain, and just next to in the caudothalamic groove, you have the germinal matrix and it's in the subependymal region in the caudothalamic groove. You have this lot of this vascular structure, the evolving vessels, and it's mainly the fetal structure as it involves by 32 weeks. And corpus callosum, I think all of us know. And again, this anatomical landmark to show cavum, septum, pellucidum. A lot of people get confused which is septum, pellucidum, which is cavum. But this is how the CSF field cavum, septum, pellucidum will be seen below the corpus callosum. And then these are the lateral ventricles and the gap between the two. And this is just to show how the brain evolves, as the maturity goes, how the brain gets more sulcated and gyrated. So again, one more comment always by when you look at eyeball, then is to look at the sulcation, gyration, and complexity of the brain. And I think I'll stop here. Thank you. Thank you.
thank you so much, sir. It's really informative. And I think, as we discussed, it is a base of the head ultrasound. And I always share with my fellow and my colleagues that the ultrasound is one of the easiest ultrasound, like as compared to the echo. So those
Hmm.
who are interested, generally you just begin with the
Being
ultrasound
prepared.
and follow by echo.
Yes.
Yeah, so it is like really good information. It is really nice session because sir nicely mentioned the relation between the external things and internal things, and most importantly, the lateral ventricle, third ventricle, fourth ventricle structure, which very important for the preterm babies, even the term baby, to rule out the certain commonest pathology. So thank you so much for a really nice session. And I think there's a few delegates. Even we have few EB members. If any have any question, then sir will be happy to answer.
So thank you for the invitation. Really, always happy to join the. I think your NNF Gujarat is very active. Our Mumbai is still not very active. We are trying to become active soon, but can't match up with Gujarat. No wonder you are the best branch.
Thank you
Okay.
so much. Really appreciate, sir. Thank you so much.
Thank you. Thank you.
Thank
Okay.
you.
Have a good day. Bye.
Sir, you can end the session. Thank you.
For
Thank you.
sure.
Thank you so much, sir. Thank you so much, everyone, for giving us the opportunity to host this session. So, with this, we are concluding today's session over here and looking forward to host you again. Thank you so much, everyone. Have a good day.
Good day.
Thank you. Thank you.